Depending on what illness or injury you're dealing with, it can be hard to decide if you need to go to the emergency room or your primary care physician or even to the urgent care. Dr. Sarah Schwertner with Primary Care Plus joins us now to explain how to get the right care for whatever you're dealing with at that time. Dr. Schwertner, good morning and thanks for being with us.
Thanks for having me on the show.
So we'll break it down for people, I guess one segment at a time. Let's start off with your primary care physician. When should you be going to see your primary care physician?
You should go to your primary care physician at least once a year for an annual wellness visit for preventative medicine. Also, you want to go for things like minor aches and pains, sprains, colds, stomach viruses, things like that. Things that are not life-threatening. And basically, your primary care physician is going to be the person who knows your medical history, who knows exactly what you need and your medical record and everything like that. So those are the things I would recommend.
So you mentioned things that are not life-threatening. If they are, or you think they might be, that's when you should go to the ER, correct? The emergency room at the hospital straight away.
Yes. So they did a study. The CDC basically had, shown that 48% of people will go to the ER if they can't get in with their primary care physician. And a lot of those things are not life-threatening. So the times that you should go to the ER is if there's a threat of loss of limb, loss of life, heart attack, stroke, things like that you cannot treat in a primary care office.
And I know, Dr. Schwertner, especially during the pandemic, a lot of people were utilizing the services of urgent care facilities. While they can do a lot, they maybe should, if it's an emergent situation, you mentioned life, limb, or a heart attack, you can go for kind of those in between doctor's office and major emergency situations. And give us examples of when that would be a good time to go to the urgent care.
So urgent cares are great for after hours. If you can't get in with your primary care physician, a lot of times people use them when they're out of town and they're not near their primary care physician. And they also are open on weekends. A lot of them you can go, same thing for minor things like scrapes, lacerations. You can even go if you have a broken bone. Sometimes they can set them right there in the urgent care facility and avoid being in the emergency room, waiting hours and hours to be seen. And that's where they have a good fit for that type of situation.
And Dr. Schwertner, there is a fourth option, and this also became a bigger option or more prevalently used option for people during the pandemic, and that's telehealth. When can telehealth visits, conversations come in handy?
So telehealth, it did become big during the pandemic, and I believe it's here to stay. It has it's very useful for primary care, especially patients that can't get to their primary care physician. The thing about telehealth that you have to have a good internet connection and know how to maneuver around the phone or the computer, but it actually is great attribute to medicine in these changing times after the pandemic.
And Dr. Schwertner, when it comes to telehealth, and I know even for your in-person primary care visits, a lot of times you have to, fill out paperwork in advance and upload it. Is that something that you kind of want to double check to see if you need for those telehealth visits before you schedule them and get in that appointment, if you will?
Yeah, so you want to make sure that you're able to get us all your information so that we can put it in the system and that you can register with whatever telehealth facility or whatever primary care physician that has the capability to telehealth before your appointment. And it's great for things like stomach aches, coughs, colds, things that we won't need to physically put our hands on and examine and make sure that it's not something bigger.
All right. Well, Dr. Schwertner, hopefully that clarified some things for people who now have so many options and don't necessarily know what to do with them. We appreciate your time this morning. Have a great week.
You too. Thank you.